Hello everyone. Today we are going to have a talk show, and the world is all in agony because of COVID-19 coronavirus, and today I'm here to discuss some of the things about coronavirus. Myself is I'm Rupak Manali. I'm a chartered accountant. I'm really worried as a accountant, as a layman, what is the impacts of coronavirus, or what are the statistics which we have been looking on the world arena, and how it is going to portray our future, whether I have to now start to work from my home, or whether I have to stock more stocks in my home, or whether the future will not be same, or being a Nepali, how much should I worry, or is there any things which government has been hiding to us. So today we are going to discuss few questions, and I'm going to ask some of the questions to our guest today. Our guest is none other than Nimesh Babuoli, and Nimesh is an IT engineer from Pastimanchal College, Pokhara. And there is a really tricky questions like why would IT engineer come to the point and all, and I'll come to that later on. But let me start by welcoming Nirmal Babuali to the show. Nirmal, Nimesh, welcome to the show.
Thank you so much for inviting me.
Yeah, thank you so much, and thank you for joining us in a short notice. First question first, like what makes you credentials, or why would viewer listen to IT engineer regarding COVID virus?
Yeah, I'll talk about personal myself at the beginning. So, I have a deep interest in international relations, and I've been following world politics and developments around the world for the past 8 to 9 years, uh, and I've been doing Model United Nations and studying about global developments, foreign policy, along with peace and conflicts and different kind of disease outbreaks and all the happenings in the world for the last 4 years, which I've been implementing it through Model United Nations as well. And talking about the COVID-19 situation, the outbreak in December 2019 in Wuhan province of China, in Wuhan city, Hubei province. So I've been following since then, and it gives me the credibility to be interviewed by you. Thank you so much for inviting me.
Yeah. So to sort things up, he said that yes, he was interested. You are interested to politics since 8 and 9 years. You have been following that closely, despite your different sector. Also, you have been engaged in MUN, that is called Modern United Nations, but platform where individuals develop themselves as a chief of United Nations in coming days. And yes, maybe I think we are trying to find out as a layman to a person who is really interested, not an expert I would say, but yes, the person as a as a common Nepali, but the Nepali who is really intrigued or who is really passionate about something which he wants to accomplish. So Nimesh, it's not that. Do you think Corona has come spontaneously, or there were some of the hints given to the world before influx into the world in Yuan province?
Yeah, so it's not the new thing that we have been seeing the corona case. In 2003, there was a disease called severe acute respiratory syndrome (SARS), which was also outbreak in China in 2003, and there were more number of people who have died. It's a more percentage of people used to die through that disease SARS. And back in 2012, a Middle East respiratory syndrome called MERS, more number of people died with that particular virus as well. We have been used to, or we have been seeing this outbreak and pandemic since long, but our world has not reacted in a way, in a pace that it should be. Talking about this COVID-19 situation in China, they have remarkably progressed, like learning from the past mistakes and learning from the past experiences of 2003 and in 2012. So it's the same kind of virus, but with a different kind of genetic modification, and it is believed to be transmitted by from the Wuhan seafood market. People buy and sell wild animals over there, and it has been transmitted. Most of the people believe that it has been transmitted from the wild animal called pangolin, and some people also argue about it transmitted from bats and all. So we have this situation earlier also, and we have seen the same situation repeated over now. And the this time it has been a pandemic, and it has spread all over the world, except in most parts of the African continent. Other than that, it has been affecting all the people of the world.
Yeah. Thank you so much. And I think, as to reframe in short, it was something, it is a history of Chinese market where the virus like SARS, which came in 2003 and in March 2012, led China to be prepared, and world had known about the new virus is going to come. It was also authenticated when Bill Gates in a TED talk also mentioned that we are not ready for the virus, and we are seeing all the malefics which is happening today because of unpreparedness. To come to the question on unpreparedness, Nimesh, do you think that European and American medical robustness has been questioned because of corona today?
Yeah, like the health infrastructure and health professionals, health experts, and the research laboratories in the United States and in the European continent is by far the most advanced and the most robust in the whole world. But the thing is that the COVID-19 impacted in a way, and it transmitted in a way that there was very less time to get like responded from the government side, and they responded lately. So there was ample amount of time when the outbreak was seen in China, but the level of response from the US government and Europeans that led to this massive chaos in both the continents. I do not doubt that there is some kind of lagging in their medical expertise or professionalism in these countries, but they do had lacked in the management of these kind of pandemics, and they didn't think that this pandemic would be of such intensity, and they realized that this should be a major global health crisis, and at that time it was too late for them to respond with what things they had, like hospitals, medical staffs, and all the resources, like the corona testing kits, and every other medical and other equipments and staffs as well. So they were late in responding to the crisis, but they have a robust mechanisms and every other thing.
Can you please give to add on that question? You said that the conditions was worse. How about you update us on some facts, like how many deaths has been already recorded in Italy, and there has been alarming rates of deaths in USA as well. And can you please give us the quick statistics on the global sphere of coronavirus updates?
Yeah, so as of now, more than 8,300 people have died till now, and more than 2 lakhs people have been infected with this disease, and most of the victims are inside Chinese mainland China. More than 3,200 have died after the outbreak in 2019, and in Italy the number has risen across 3,000, and unfortunately last day around 425 people died due to the outbreak in Italy. One of the most chaotic scenarios being seen in the dire situation we can see in the Islamic Republic of Iran, where more number of people are being dead because of slow response from the government and negligence from the health ministry and the Iranian regime over there. So many people have been killed, and I think the Iranian case will, or Iranian casualties will overtake China and the Italy, because they have been slow to respond to that. Talking about the North American continent and the USA, United States particularly, there are around 100 deaths till now, but there is alarming rate of spread of the coronavirus, and the Trump administration response to it was little bit late, and they were trying to defend their weaknesses at the first, and now we can see how it has impacted to the global economy, which we'll be talking later as well. And in India, yesterday in South Asia, one Bangladeshi citizen has died. In India, the death toll has crossed more than 5 people. Southeast Asian nation, the rate is alarming. In Britain, the number is less than 100. In French Republic, the number of cases has significantly increased, and the number of cases in the number of casualties in Spain has also tremendously increased over the time, but they have significantly responded now, so the outbreak will be contained within these 15 to 20 days, and the casualties and the human life lost will be decreased. And we can see the African continent is more or less not affected by this situation, by this endemic.
Yeah. So many countries has been affected. Lot of lives has been lost. Many casualties have been reported, and the situation is worse. To ask you that how many countries has been affected? Is there any legitimate number of countries seen it by World Health Organization?
Yeah. They have updated about these data and statistics. I earlier in the morning today I have surfed webometrics.com, which they have sourced from the World Health Organization itself. Around more than 90 countries have been like infected by these COVID-19 virus, but the thing is that not every country citizen, most of the citizens are not affected by this, because we only have more than around 2 lakhs people who have infected by this disease, and the significant number of people who are infected are in China and in Europe, and World Health Organization has already told that the center of global this outbreak, this disease is in Europe, and uh, the countries like Nepal and African nations or smaller countries, or the countries which are less populated and which are least affected, there are very more number of countries are there. So in Nepal we can see that only one cases has been reported till now, and the person has been returned home safely and he is free from coronavirus, he has recovered. So we can talk about other countries like Bhutan, even Bangladesh. Unfortunately, a person has died over there, but the number of cases is significantly low. Around 100 countries have been infected by this, but most of the cases are centered in Europe and in China, not in other parts of the world. And like more number of cases are being reported in the Northern American region.
Okay, so what do you think, in short, if you have to answer, what is the impact of its coronavirus as in a global economy?
Yeah, so it has significant impact to the global economy. U.S. Federal Reserve has cut the interest rate to 0%. That's a surprising fact, because the central bank of any country put the interest rate to 0% only in such a grave situation, and they have and the share market in the U.S. Nasdaq has plummeted to around like 36 years low, if I'm not wrong, and all the Asian shares like Sensex, Bombay Stock Exchange, and Shanghai FTSE, Hong Kong Stock Exchange, also called Hang Seng, and Tokyo Stock Exchange. The share markets in all across the world has plummeted by this outbreak. Um, More number of jobs are being people are being they have been asked by their company that they won't like they will be they will be losing their jobs because the world economy has shrink on that part. And next thing is that we can see how it has impacted to the US economy and the global economy by the Trump administration, US government. They have been planning to pump $950 billion in US economy on that part. And the European Council had also proposed of pumping more than 950 billion dollars in the economy. So country like countries who are severely affected, except for China, their economy has been hard hit because all the people have been self-isolated in their home. Economic activity has been halted to almost zero in countries like Italy, Spain, and in most of the European nation. German Chancellor Angela Merkel, she has also asked our government to prepare about the worst case scenario of like getting their German population, more than 70% of German population getting infected, and they are working on that part. So overall, more number of jobs are being lost. Many low paying, low earning global citizens have been vulnerable to the crisis. uh, Significant job cuts in manufacturing. More like car plants in the USA, in the United Kingdom have completely halted their production, and this situation has been seen in all over the European countries, not only in car production but in manufacturing business. Everything, every economic activity source has been halted by this situation. So the dire situation is still coming, so we cannot conclude to the point now itself, but that how will the economy will be. But we can predict that the situation will be much worse than the government they believe to be.
Okay. So as you said that there is a long-term impact and every economy has been affected, including USA, Germany, and the emergency situation has been called in Italy and all. So the movement of goods has been halted. The movement of people has been halted. That is why the economic activity has been not properly done. So it is also an indication of the mild recession, I think, as per your rhetorics. My next question is, what is the magic in the country Nepal? Why the Nepalese, there is no any one confirmed case in our country Nepal?
Yeah, before answering that question, I would like to add a sentence on earlier question. Uh, 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 I'll tell this at the end of the interview. So, in Nepal, we do lag in health, whether in health infrastructure, we don't have any corona testing kits in a level that we should have. Like there are only few thousands of corona test kits available here in Nepal as per the government, but most of the people don't believe so. Even I don't believe in about that fact. So uh, more number of people might have get affected or might have been infected by this COVID-19 virus, but COVID-19. But since they haven't been to testing and or they haven't been reported, so I guess we cannot confirm for sure that there is no one infected here in Nepal. In our country, like there is public outcry over the response by the government. We can see the halting of SE exam at the last moment yesterday at around 5:30 p.m. SE was due to happen from today. So the government has ill prepared on this part. It's not that Nepali hasn't been infected by this thing, but it's we can conclude that there have been infection among Nepali people, but they haven't get reported, or the government doesn't want to flash out those things. and we can see the high level task force committee led by our deputy prime minister Mr. Ishwar, our defense minister Ishwar Pokhrel. He has been leading this committee. So they have been acting in a way so hurriedly at the last moment. So looking at that thing, like I guess the government is trying to hide something from us, and more number of people might have been affected by this part. uh, Next thing I would like to add upon is that there has been good news about this COVID-19 after the outbreak in 2019 December. China reported 0 cases inside the country itself, and around 30 cases were reported who flew from other countries to China. So they have contained. China has remarkably progressed to contain that virus. And next thing is that all the Southeast Asian countries, they have been trying to isolate their country, and I think our government should also follow on that part and close our only international airport apart from emergency situation. And we should I think follow the procedure of quarantining all the citizens here in Nepal. And next thing is that all the major sports event has been cancelled by this COVID situation, and major people gathering has been cancelled all over the world. And it's really frustrating to see that our government has been has prepared bad for the situation, and the impact or the cost of not preparing well will be seen in the days to come. So let's hope that the COVID-19 will be contained, and we'll work together, keeping distance apart from each other to contain this global outbreak, and we'll cope with this global health crisis of 21st century.
Okay, so as you mentioned that there is no substantial evidence that Nepal government has been defaulting us by not giving us the whatever there is a cases of coronavirus, and we cannot say in with the support of the evidence that there has been. But as per your conversation that I got the point that it's highly unlikely that there are no cases. We are not prepared for this. We have to prepare. We have to be aware, and whatever government has been whatever the high level task force has been doing in an immediate venture, it has been suspicious enough. But yeah, keeping that in mind, there is a legitimate problem of lot of resources going illegitimate around the world. People has been frightened with a lot of myths and all, and there are sources which we must follow because everybody have access to social media nowadays. So what do you think are the legitimate sources, or this the video we are making currently is also a kind of illegitimate resources, I would say. But whatever you have been saying to us is backed by some of the website or some of the data from the legitimate resources, right?
Yes.
So what do you advise to the public, or what are the website or what are the resources or data you should follow, or what are the data you should rely upon, and what are the data you should not? So can you please advise on that point?
Yeah, first thing first. So people should isolate themselves, and better not to go outside from their home unless there is an emergency or urgent situation. First thing is the only remedy that is more effective than rest of the thing. And I've been seeing people using masks and trying to protect themselves. That is not the best. Wearing masks doesn't contain is not the best solution to get not infected by the virus. It's ineffective medium actually when a person sneezes or coughs, then he or she will he or she will throw water droplets, and that only will coronavirus will only transmit at that moment. And we have been rushing towards grocery store, we have been rushing towards drug store and buying all these masks, and we have been creating a next crisis of shortage in black marketing here in Nepal. So more number of cases will be seen because of this thing. We don't need masks when we don't want to go outside from our home. Mask is needed by the health professionals who are diligently working together, working to protect us and help those infected people. They need those items. We don't need that much. So next thing is that when you drink lukewarm water, then it's a best way to get contained, and the virus gets contained when the temperature is high. Luckily, our summer season is coming soon, and if we get managed to contain this virus within the summer season, then the bright days are ahead. Next thing is that when there is person or infected person, then we should really take care of him or her, but we should be really we should take really precautionary measures not to get infected by him or her. Next thing I want to tell is that we should not go haphazardly directly to the hospital and get sick medical advice. If a person is suspicious on the COVID-19 disease, then COVID-19, then he or she should not go to directly to hospital. He or she should call the helpline that our government has provided, and he or she should follow the necessary steps, so that when he or she went to the hospital, he or she should not transmit that when they have been like sitting standing of line in OPD or before doing the testing and all that stuffs. And the next thing is that we have to really take care of our elderly people and the people who have low immunity. We millennials or the people with our age, it's not that much deadly to us, but we might be the carrier for them to so that they will be affected the most. So we should really focus on that part. And the next thing is that we should help our government in this particular scenario, because we don't know, our country has never have such a major infectious outbreak. We have seen the major crisis in our country in the form of earthquake back in 2015, but the infectious disease outbreak is first in Nepal in the modern time. So I think we should work together, and we should be connected socially with each other in social medias, not in person. Next thing is that we should help each other. So during this crisis, many people can lose their job, or they do not have paycheck to have food or to survive during this dark hour. So someone should help economically or on that part, and we should not rush to buy items, to buy toilet papers, to buy grocery store in the grocery shop, and create a new crisis apart from coronavirus situation. So if you work together, then I think we can contain. We still have time to act on this wisely. So I think we should do our part and let the government do their part, let the medical professionals do their part. And when we do our own duties, fulfill our responsibilities, then I believe if we work together, then it won't be that much of problem or trouble for any one of us.
As you mentioned, we have to help each other. We have to let government do things, and as our government is not equipped enough, we have to help as a responsible citizen. And could you please give some of the sources like which people or laymen like me can follow and or our viewers can follow on? Like World Health Organization is one of the legit sources, because lot of misrepresentations, lot of misinformations has been guided to the social media. Even there was a case when people were talking about alcohol consumption can reduce the chances of getting coronavirus. Even if you put the alcohol in your hand, then it will work as a hand sanitizer. So these kind of myths are always prevalent. So what do you think would be a proper websites which you have been referring to for coming up to these facts which you have provided in the interview, and what are those legitimate sources you want to ask to the viewers to only view to that legit sources, so that the misconceptions conceptions will not be there.
Yeah, so primarily we should go to the fact and resources from the World Health Organization, and as a layman, we should also follow the Ministry of Health and Population of our country, or the respective ministries or departments in the respective country as well. And next thing is that in World Health Organization website, they have clearly mentioned about every details about the corona situation that is happening all around the world. They have specifically provided the details regarding the particular country as well. So the next thing we can get help from is the Center for Disease Control and Prevention of the US government in the United States. So they have been professionally expert, or they have been a pioneer in medical field and in such kind of situations. So the CDC, we have to follow those websites as well. Next thing is that I want to tell to every public here that do not go after social media posts from Facebook and all. Go only through the official and legitimate, authentic media sources of national media as well as other organizations all around the world. Listen to the briefings from the radios, public radios, Radio Nepal, and other media, television media, and other social media which are legitimate and which should be which you can trust with. And next thing is that you have to spread the proper or true message to everyone, every people, not that the rumors or the conspiracy theories that has been provided in the market, even by Mr. Swami Baba Ramdev. He has been falsely saying that ashwagandha's root will cure coronavirus. He has been falsely arguing about that fact, and he has been misleading the Indian public. So there might be the so-called fake expert on that particular matter who can portray themselves as an COVID expert, and they will try to convince you on that part. We should not listen to them. We should listen to the health professionals and health experts. We should listen to the official media and authentic media. We should follow World Health Organization and Ministry of Health and Population, and we should follow all the relevant sources which are too important, and we should listen to these sources, authentic sources, and convey the proper message to every one of us, so that the false narratives will diminish, and the proper narrative will spread to every one of us.
Thank you so much, Nimesh. And I got the point. Now, as a layman, we have to only see the legitimate sources. We have to rely on World Health Organization, or we have to go directly to their website and see. We should not go to a social media and share some of the falsified information, because today people have been looking forward for getting the publicity out of the expense of the emotion of the people. There has also been a lot of rumors and conspiracy theory going on in the market regarding, we can see those things if we just scrolling on our Facebook. As a responsible citizen, as advised by Nimesh, we can not share and save a lot of lives. And also as a responsible citizen, we can be responsible, and we can only praise those praiseworthy things which have been done by the people. So thank you so much, Nimesh, for giving your valuable time, and I hope that the corona is going to reduce, and as there has been a outbreak, or there has been started of trail of vaccines all around the world, especially in China and especially in USA. I think let's keep the finger crossed. And thank you so much for giving your valuable time on this show. Thank you so much.
Thank you. No handshake. Namaste.
Yeah, namaste. Namaste.
Yeah.
No handshakes. Namaste. So, dear viewers, the corona we discussed today in this meeting regarding why corona, was there hint in the world? The answer was yes by enemies. The second was, do you think American or European health facilities was not enough? Yes, it was the answer, because the world was not prepared for the virus. Our third point was, what were the updates on the countries. There were alarming situation in the Italy, Iran, and USA, as said by Nimesh. And what were the impacts of global economy? The recession is here. We have to. It is a hard drink to swallow, but the recession is here. And our fifth question was, what's next? In the next point is that the corona might spread with a huge amplitude, but the vaccine might be discovered as soon as possible, because the China